One additional thing that goes into effect in 2011 is that for those of you who have 200 or more employees, starting then, you must automatically enroll new employees in your health insurance coverage. They can later choose to opt out if they have coverage somewhere else or aren't interested, but you have to do that automatic enrollment process if you have 200 or more employees. And as Clinton mentioned, this statute is different from a lot of others. Those of you who are used to FMLA know that it applies to employers who have 50 or more employees, and it's pretty easy to tell who's an employee. But within this statute, employee is defined in ways that aren't consistent. Sometimes it's full-time employees, and they define full-time as those who work 30 hours or more a week, as opposed to the 40 that we're used to seeing under the Fair Labor Standards Act. Sometimes they count employees by who's a full-time equivalent. They add up all the hours that are worked by employees and then divide to come up with the number of full-time equivalents. Sometimes part-time employees are included, sometimes they're not, and so the statute is internally inconsistent in how it defines employees. So for each of these provisions, you kind of have to look at the statutory language and see, okay, in this section, how are they defining who's an employee, and figure out the numbers that you have and whether these specific provisions apply. So that's kind of what's coming down the pike in 2011.
If I could touch on that employee concept again. Sometimes you include even the owners, and sometimes you don't. So I'm glad you brought that up again. I forgot to mention on the tax credit, for example, when you're counting employees and when you're calculating compensation, you exclude owners and their family members. So, so that number 10 might really be a much larger number if it's a highly, if many of the employees are family members of the owners. So, Karen, what about 2012?
2012, 2013. So I think we've had plenty on our plate for 2010, 2011. Maybe the regulators had foresight to realize that, because 2012 and 2013 are pretty light in comparison to what we're going to be dealing with on the horizon, and then what comes up in 2014 is pretty substantial as well. So just a couple of things that we'll touch on for 2012 and 2013. The one thing I want to point out in 2012 is in the middle of your slide, which talks about the summary of benefits of coverage. This is an interesting requirement. It's a very specific requirement. So most of you have some type of document that you make available to your associates that gives a broad overview of what your coverage is. Schedule of benefits, summary of benefits, it'll be called a variety of things. The regulations now are going to stipulate that that document can be no more than 4 pages long. And as you've looked through the presentation, you've probably seen a lot of comments about communication and notification. So I think we may be challenged in how to make that 4 pages long. So we're going to wait for clarifications, but it's a 4-page summary, 12-point font, and if there are multiple languages within your organization, 10% or 500 employees, whichever is less, you have to make that available in multiple languages representing your population. So it's going to be very specific in terms of what it needs to look like and the information it needs to contain. The most interesting part of this particular provision is not noted on your presentation, and it's the timing. So you have to make this available to all new employees. That seems pretty straightforward. Most of you probably use a new hire packet. You've got that information in there. Shouldn't be a problem. But the tricky part is notification at open enrollment. And what this particular provision says is you have to have this notification in this font with all these requirements in your associate's possession 60 days before your policy renewal date. So how many of you have your renewals all done, decisions made, signed, sealed, delivered 60 days before they renew? I'll be shocked if it's 1 or 2 people. It's just not the cycle of how historically insurance has worked. So it's going to turn the whole industry on its ear, because if this holds true via IFRs, any kind of clarifications that get issued, the first thing that happens is the insurance companies and the reinsurance markets, everybody has to step back from a timing standpoint based on what we currently work with today. And at first pass, you may think, well, that's okay, that's no big deal. But the sooner your experience gets cut off when your renewal cycle is going forward, the more trend factor, the more incurred but unreported factor has to be put in. That fudge that goes into the renewal to account for those claims that haven't come through the cycle yet grows. So the further back your data gets cut off from your actual renewal date, the more fudge gets put in those premiums. So there is a definite premium impact to having this one statement in this clarification or in this provision that is probably the result of a lack of understanding the cycle of what really happens within the insurance industry and the employer process that you go through. So we're anxiously awaiting some clarifications on this provision. We've got a little time before we're going to have to comply, but that's something to be aware of.
One thing that is interesting in terms of the notice, because the government has been so specific about what size font you have to use and what language you have to use, they didn't say what size paper. So Clint and I are thinking maybe you could put it on a scroll.
We're going to go back to scrolls.
Yeah,
That's what I think. I mean, those things can be endless. So, you know, it's usually at this point when we're making presentations, we kind of look out in the audience and you kind of see this glazed, shell-shocked look like, oh my word, are you serious? And then we get to 2013, and we do have a couple of changes that are going to happen, but the big thing that happens in 2013 is we get to start paying for all of this. So we start to talk about the tax. Before I do that, Karen, do you want to talk about the FSA requirements and the retiree drug program, or do you want me to?
I'll just touch on those things real quick. Terry mentioned earlier that one of the things that's impacting eligibility is no over-the-counter drugs without a prescription. Now that actually starts, remember these are IRS provisions that we're talking about at the moment. Those are calendar year based. So depending on your particular plan year, you may not be in sync. But starting January 1 of 2011 is when the no OTC without a prescription kicks in, regardless of what your particular cafeteria plan year is. And in 2013, January of 2013 is when they are establishing a limit. Now, as an employer, you've probably established limits already for your unreimbursed medical accounts, but there was no legislative limit except on dependent care. Now there's going to be a legislative limit on your unreimbursed medical, and it's going to be $2,500. Now that's going to be probably for a lot of employers a very different landscape, because most of you probably have a higher limit that you've established as an internal limit. To those, a lot of employers are doing $3,000, $4,000, $5,000 per year. So that's going to be a little bit of a shock to the system when that comes into play. There's another tax provision relative to the retiree drug subsidy program. Probably very few of you in this room fall in this category, but that is when that change comes into play, is in 2013. And then Clinton's going to talk about some of the Medicare tax implications and what happens to the tax tables as we go forward. And then we'll have 2 or 3 minutes to talk about 2014, which is another big bite of the apple in terms of health care reform.